Bismillahirrahmanirrahim. Today we will continue our previous lecture in which we discuss the various abnormalities that result in the thrombosis. Today we will discuss the various morphologies that are related to thrombosis, various terms and various explanations that needs to be addressed, and they are particularly important from the OSPE point of view. They are usually asked in the OSPE examination. So now we'll discuss the various morphologies that are associated with the thrombi. Broadly speaking, we divide the thrombi as arterial and venous thrombi. Where arterial thrombi begins, where venous thrombi begin, it needs to be elaborated. Arterial thrombi, they usually begin at the site of endothelial injury or where there is turbulent blood flow, while venous thrombi, they begin at the stasis, where there is stasis of the blood flow. If we talk about the direction of growth of these thrombi, arterial thrombi, they usually grow against the blood flow, that is in a retrograde manner, while venous thrombi, they grow along the direction of the blood flow. Here another thing is mentioned in this slide, that is the lines of Zahn. The lines of the Zahn, they are alternating pale and red lines which are present in the thrombus. These lines of Zahn, they contain, as I told you, they contain both the pale areas and the dark areas. The pale areas, they represent the platelets and the fibrin, while dark areas which are red in color, they represent the red blood cells. So line of Zahn, they are particularly important while describing the morphology of a clot or morphology of thrombus. So this photomicrograph, it represents the lines of Zahn, and as you can see that in this picture there are numerous pale colored areas and numerous dark or red colored areas. The pale color areas, they are devoid of the red blood cells, or the number of red blood cells is very less in these pale color areas, and these pale areas, they usually contain the platelets and fibrin, while dark red areas, they are rich of red blood cells. So please remember the line of Zahn. There can be asked in the OSPE a question of one number, describe the lines of Zahn. So you have to write these alternating pale and red lines and their composition. Mural thrombi or mural thrombus, another important term that needs to be elaborated. Mural thrombus or mural thrombi, they basically arise in the heart chambers or in the lumen of the aorta, the major blood vessel supplying the blood to whole of the body. Why mural thrombi they arises? It is associated with various abnormalities, various conditions like myocardial infarction, myocarditis, which is the inflammation of the myocardium, or it may arise due to various arrhythmias, or it can arise due to cardiomyopathies, especially the dilated cardiomyopathy. So the important location, the question here arises, what is the important location of the mural thrombus? It is the heart chambers, and the second important location, that is the aorta. So there are the two pictures which are present on your screen, which shows and both of them, they show the mural thrombus. If you look at the upper picture, you can clearly see that this is a heart chamber and a mural thrombus that is present in the central portion of the chamber. It is arising from the endocardium, and the picture below, it is a more elaborated view showing the three different parts that are seen, consisting of mural thrombus that is directly attached to the endocardium, and beneath the endocardium you can see the myocardium. So mural thrombus, another important thing that needs to be elaborated. Let's have a brief look about the important characteristics of the arterial and the venous thrombi. When we talk about the arterial thrombi, the most common site, that is the coronary circulation, followed by the cerebral arteries, and then comes the femoral artery. If we talk about the composition of these arterial thrombi, they are relatively rich in red cells, platelets, fibrin meshwork, and the leukocytes. Arterial thrombi, they are frequently or they are usually occlusive in nature. As you already know, the arterial thrombi, the most important thing that results in the origin of these arterial thrombi, that is the endothelial injury and the turbulent blood flow. So all these things of arterial thrombi, they differ from the venous thrombi. And if we talk about the arteries, especially the major arteries like the coronary circulation, atherosclerosis, that is a very important cause of the arterial thrombosis. And if we talk about the mural thrombi, which is also a form of the arterial thrombi, which develops in the heart chamber, that can be a very important cause of the myocardial infarction. Moving on to the venous thrombi. Venous thrombi, they usually arise at the site of the stasis, and they are almost occlusive in nature. Arterial thrombi, they are usually occlusive in nature, while the venous thrombi, they are almost occlusive in nature. And when we talk about the most common sites of these venous thrombi, they usually are present in the lower limbs. To some extent, the upper limbs or the upper extremities, they can also be involved. Similarly, ovarian and the periuterine veins, they can also be involved or diseased as a result of these venous thrombi. If we talk about the composition of these venous thrombi, as it is due to sluggishness of the blood flow, so therefore there is massive amount of the red blood cells in these venous thrombi, and this is the reason they are also called as the red thrombi or the stasis thrombi. And another important feature of these venous thrombi, that they contain the lines of Zahn, which are a feature which help to distinguish these venous thrombi from the postmortem clots. What are the postmortem clots? We will discuss in the coming slides. So, as we have studied the few important characteristics of these arterial and venous thrombi, in the next coming slides I'll elaborate them in a tabulated form so that you can write the differences very easily. This is a picture that is showing the arterial and venous thrombus. If we look at the arterial thrombus, it is growing in a retrograde fashion, that is against the blood flow, while the venous thrombus, that is growing towards the blood flow. And again, have a look at the composition of both of these thrombi. Arterial thrombus, it contains few red blood cells, while venous thrombus, it contains numerous red blood cells. Third important thing that needs to be elaborated here, that if you look at the arterial thrombus, there is an endothelial injury, while if you look at the venous thrombus, there is no associated endothelial injury. So venous thrombus or the venous thrombi, they are almost exclusively due to stasis of the blood flow. This is an artery that has been thrombosed by a thrombus, by an arterial thrombus, completely blocking the blood supply to that specific organ from where this arterial section that has been taken. This is a tabulated form showing the differences between the arterial and the venous thrombi. So you can make a table and write these 5 or 6 differences, which include the etiology, the pattern of growth, line of Zahn, color, occlusiveness, and the location. If we talk about the etiology, the arterial thrombi, they arise due to some endothelial damage or due to turbulent blood flow, and the venous thrombi, they usually arise as a result of the stasis. Arterial thrombi, they grow against the blood flow or in the retrograde manner, while venous thrombi, they grow with the blood flow. Lines of Zahn, they are prominent in the case of arterial thrombi, but in case of venous thrombi, they are not that much prominent. If we talk about the color of the arterial thrombi, that is somewhat pale, or here I have mentioned that is gray in color, while venous thrombi, they are more red in color, and they are also called as the stasis thrombi. Arterial thrombi are generally occlusive in nature in not that much number of the cases, but it is occlusive. While venous thrombi, that is almost always occlusive in nature. If we talk about the location, arterial thrombi, the most common being the coronary artery, cerebral artery, femoral artery. It is also seen in the heart chambers. It is also seen in the aorta where atherosclerosis has occurred. While venous thrombi, they usually present in the lower limbs and where it presents as deep venous thrombosis, while it can also be seen in the upper limbs. It can be seen in the periuterine veins or the ovarian veins. So this is a very important table. Please have a look on this table. It is asked in the examination. So postmortem clots, they are also important and they are related to the thrombosis. When we talk about the postmortem clots, we can easily confuse them with the antemortem venous thrombi. So there are few differences between these two types of the thrombi. The postmortem clots, they are usually gelatinous in nature, and the red blood cells, they settle with the gravity to the lower portion, to the dependent portion. So the dependent portion of the postmortem clot, that have a red appearance, while the upper portion of the clot that contains plasma, it has a yellowish look, and that is called as the chicken fat appearance. And third important thing is that the postmortem clots, they are not attached to the underlying vessels. So these are the three important differences of the postmortem clot from the antemortem or the venous clot. Antemortem or the venous clots or the venous thrombi, they contain these line of Zahn, and the line of Zahn, they are not present in the case of postmortem clots. Second important difference is the postmortem clots, they are not attached to the vessel wall, while antemortem venous thrombi, they are attached to the vessel wall. And third important difference is the antemortem venous thrombi, they are red in color, while postmortem clots, they usually have a lower or dependent part that is reddish in color, dark red in color, while the upper part, that is yellowish in color due to the presence of plasma, and that is called as chicken fat appearance. So these are the few important differences between these two clots, the postmortem clot and the antemortem clot or antemortem venous thrombi. So this is a diagram that is showing the postmortem clot, and you can see clearly that the lower portion where the current jelly is written, it contains the more red blood cells, and that is more reddish as compared to the upper portion that is somewhat pale in color, and it contains more plasma, and hence the name chicken fat appearance. Next important term that needs to be studied, it is the vegetations, or usually called as the cardiac vegetations. These vegetation, they are small thrombi that arise on the heart valves, and they are usually due to bacterial or the fungal infection, and these bacteria or fungi, they previously adhere to the damaged wall, and they can arise as a result of various diseases, for example infective endocarditis, for example rheumatic heart disease. Sometimes some non-bacterial thrombotic diseases like non-bacterial thrombotic endocarditis, it can also give rise to these vegetations. But in case of these non-bacterial endocarditis or non-bacterial diseases, the thrombi, they usually do not contain any kind of bacteria, and they are called as sterile vegetations. Another important condition of sterile vegetation, that is called as Libman-Sack endocarditis, that arises in the patients who are suffering from systemic lupus erythematosus, SLE. SLE is the abbreviation of systemic lupus erythematosus. So sterile vegetations, they occur in the case of non-bacterial thrombotic endocarditis and Libman-Sack endocarditis, while the vegetation which contains some bacteria, it usually arises in the infective endocarditis. This is a picture of a heart chamber and showing heart valves, and you can see that on the valves there are numerous small vegetations which are shown by these arrows, these dark gray arrows. These cardiac vegetation, the Libman-Sack and endocarditis, infective endocarditis, and rheumatic heart disease, you people will study in detail in the 4th year MBBS. A very important slide, the fate of thrombus. It can be propagation, it can be embolization, it can be dissolution, or it can be organization and recanalization. If we talk about the propagation of the thrombus, it occurs due to accumulation of the platelets and the fibrin meshwork. Embolization or embolus formation, it is the dislodged thrombus from one site, and it is transported to elsewhere in the vascular system. For example, the thrombus, if it is present in the lower limb, it can get dislodged, and then it can travel to the pulmonary circulation, resulting in the pulmonary embolism. Dissolution, it occurs due to the fibrinolysis, and this fibrinolysis, it can be natural or it can be due to some medications on drug, but as a result of this fibrinolysis there occurs the complete dissolution of the thrombus. The fourth or the very important term is the organization, the recanalization. Generally, the old thrombi, they become organized as a result of ingrowth of the various types of the cells, for example, smooth muscles, fibroblast, and the endothelial cells. Ultimately, in these organized thrombi, a canal develop and which establish the continuity of the initial blood vessel. So organization and recanalization is very important fate of the thrombus, and it is very important especially in the case of vital organs like coronary circulation and the cerebral circulation. So fate of thrombus, 2 नंबर का क्वेश्चन ऑस्पी में पूछा जाता है, व्हाट इज द फेट ऑफ द थ्रोम्बस. सो 2 नंबर का अगर क्वेश्चन है तो यू जस्ट हैव टू राइट द नेम्स. और अगर SEQ में 5 नंबर का क्वेश्चन पूछा जाए, एलेबोरेट द फेट ऑफ थ्रोम्बस, देन यू हैव टू राइट 2 to 3 लाइन्स ऑफ दीज 4 टर्म्स ऑफ प्रोपगेशन, एम्बोलाइजेशन, डाइसोल्यूशन, ऑर्गेनाइजेशन एंड recanalization. In the last lecture, I told you that we'll have a brief look on the disseminated intravascular coagulation or DIC in the next lecture. If we talk about DIC, it is not a specific disease itself, but it is a complication that can arise in a large number of the conditions that are associated with activation of the thrombus or the whole pathway in which the thrombin that is produced. It is also called as the consumption coagulopathy. What happens in the DIC, the process of coagulation and the fibrinolysis, that are both of them, they are dysregulated, and as a result initially there occurs a widespread clotting throughout the vasculature, and when all the coagulation factors, they are consumed, causing the clotting, at the end, when the coagulation factors, they are consumed, it will result in the bleeding, and this is the reason it is also called as consumption coagulopathy. If we elaborate this term consumption coagulopathy, initially there is coagulation of the blood due to the coagulation factors, and when those coagulation factors, they are consumed, it will result in the bleeding. So this is a very technical term and it is called as कंजम्पशन कोएगुलोपैथी. सो डिटेल में आप लोग पढ़ेंगे इसे इंशाल्लाह ताला नेक्स्ट ईयर 4th ईयर MBBS में. व्हाट इज कंजम्पशन कोएगुलोपैथी, हाउ, व्हाट इज द पैथोफिजियोलॉजी और द पैथोजेनेसिस ऑफ दिस DIC, इसमें और कौन कौन से फैक्टर्स इन्वॉल्व हो जाते हैं. इट इज़ अ क्वाइट वास्ट टॉपिक और इसके बाद जब फोर्थ ईयर में आप लोग ये DIC पढ़ोगे तो देर इज़ अ प्रैक्टिकल इम्प्लीमेंटेशन ऑफ DIC in sepsis, in bacteremia, and numerous diseases. And this DIC or disseminated intravascular coagulation, it is particularly important if we talk about the patients in the ICUs, neonatal ICUs, in the adult intensive care units. So this is quite important. So today we have finished the topic of the thrombosis. From next lecture, we'll discuss another important topic, that is the embolism, that is also related to this thrombosis. So till then, take care and Allah Hafiz.